Assessment of maximal oxygen uptake on a cycle ergometer. Maximal oxygen uptake, also known as VO2max, is a measure of an individual's peak whole-body oxygen consumption. This is presented as an absolute value, liters per minute, or relative to body weight, milliliters per kilogram per minute. Initial research in the 1920s by A.V. Hill and Hartley-Lupton demonstrated an upper limit to oxygen uptake. Hill and Lupton based this theory on the plateau in oxygen consumption observed with increasing workload. Additional components of Hill and Lupton's VO2max paradigm included VO2max would be variable amongst different individuals, VO2max as a prerequisite for endurance performance, and that VO2max is limited by the cardiorespiratory system's ability to deliver O2 to exercising muscles. Before the test, determine the risk stratification of the participant and schedule a physician if necessary. Ask the participant to refrain from unusual activity for at least 24 hours and to wear appropriate clothing to the test. This includes athletic gear, such as shorts, a t-shirt, and athletic shoes. Request the participant use the restroom prior to their initial body mass measurement. Ensure the metabolic cart has been given sufficient time to warm up and is appropriately calibrated, as well as pre-assembling the mouthpiece or testing mask prior to the participant's arrival. Make sure to wear appropriate personal protective equipment, such as gloves. Have the participant remove their shoes and any excess clothing. Ask the participant to step onto the scale and wait for body mass measurements to stabilize. Once weighed, record the mass of the participant. Have the subject lie down in a supine position and attach 12-lead ECG electrodes according to the standard exercise testing protocol. If the participant is female, use a separate room to ensure privacy. After 3 minutes of supine rest, measure blood pressure and obtain heart rate using the 6-second ECG rhythm strip. Record resting heart rate. Ask the participant to stand slowly and remain standing for 2 minutes. Once standing, make sure ECG wires are contained so that they do not interfere with the participant during the exercise test. At this point, measure blood pressure and obtain heart rate using the 6-second ECG rhythm strip. Explain the procedure and exercise testing protocol to the participant. It is important the participant understands that the test will be difficult and requires a maximal effort. Assist the participant in mounting the cycle ergometer. Have the participant place their feet in the pedal straps. Adjust seat height so that the participant's knee angle is roughly 150 degrees. Then, adjust the handlebar to a comfortable position for the participant. Ask the participant to place the pre-assembled mouthpiece in their mouth and make a tight seal. Adjust the headgear so that the participant is comfortable. Have the participant put on the nose clip so that they are unable to breathe through their nose. Next, connect the appropriate sampling tubes to the mouthpiece or testing mask of the participant. At this point, before starting the test, check that the gas values are stable and within physiologic ranges before proceeding. Relative VO2 values should be approximately 3.5 milliliters per kilogram per minute, or 1 metabolic equivalent. With the age, sex, and physical activity status of the participant in mind, select the appropriate protocol from the provided table for the cycle ergometer testing session. Initiate a 2-minute warm-up, instructing the participant to pedal at a cadence at or above 60 revolutions per minute. Check metabolic cart and ECG readings for accuracy, i.e., within physiological range. Record the participant's workload, heart rate, rating of perceived exertion, and blood pressure before conclusion of the warm-up stage. Begin the first stage of the testing session by increasing the cycle ergometer resistance to that of the initial minute as described in the provided table. At the conclusion of each minute, increase the workload by a fixed amount, minute increase, as listed in the provided table. Additionally, at the end of each stage, Print a 6-second rhythm strip, determine the heart rate, and ask the participant for their rating of perceived exertion. Record this data. Blood pressure should be measured at the end of every other stage. Blood pressure measurement during exercise can be difficult. Ensure your clinician is comfortable and competent with this task. Once the participant reaches a rating of perceived exertion greater than or equal to 16, blood pressure and rating of perceived exertion values should not be recorded to reduce participant distraction. Terminate the exercise test if the participant requests to stop, reaches volitional exhaustion, is unable to sustain the appropriate cadence of 60 RPM, or if they exhibit any of the ACSM's indicators of test termination. A valid VO2max test is defined by meeting two of the following 4 criteria: a plateau of oxygen consumption, a rating of perceived exertion greater than or equal to 17, achievement of age-predicted heart rate max, and/or a respiratory exchange ratio of greater than 1.1. At the conclusion of the test, remove the mouthpiece or mask and provide the subject with a towel to manage sweat and saliva. Reduce the load to 25 to 50 watts and begin 3 minutes of active recovery. Ask the subject if they ever felt short of breath and their primary reason for stopping, whether it be overall fatigue or just leg fatigue. Also, ask the subject what their final rating of perceived exertion was at the end of the test. Each minute during active recovery, record heart rate. At the end of active recovery, measure blood pressure. Have the participant carefully move from the bike to a supine position for 2 minutes. During supine recovery, record heart rate every minute and blood pressure at the end. Disconnect the ECG electrodes. Make sure the participant is recovered and ready to depart. This has been a presentation by the Human Performance Laboratory at Ball State University for VO2max cycle protocol. Thank you for watching.